diabetes. In a moment, we're going to be talking about diabetes and the relationship with cardiovascular disease. And this happens even though you take your medications. Hi, this is Georgina Zagara Chavez again. I'm a physician, naturopath, and acupuncturist, and we're going to be talking about diabetes, and I'm going to give you a series of videos regarding hormonal imbalances, and in these cases, diabetes, since insulin is a hormone. Why diabetes and cardiovascular disease, they go hand in hand? Well, the statistics show that 68% of the diabetic population, they will experience cardiovascular disease in their lifetime. Unfortunately, diabetes is one of those diseases that they affect all of the body. One of them is the heart, the kidneys, the skin, basically everything. The eyesight, We're gonna just talk about the cardiovascular disease. Why they have this? Well, first of all, when you're pre-diabetics, in order for you to be pre-diabetic, you have to have certain symptoms. One of the symptoms is the big belly. So most people, they have either obesity or they are overweight, one of the two. So that's number one. Number two, most of the people with pre-diabetics, they have high blood pressure. High blood pressure, a lot of people think that when you reach certain age, like 35, 40, or 50 years old, you have to have high blood pressure. It's not. High blood pressure is a problem that we have. And a lot of these things caused by lifetime abuse. We are exposed to so many things, and this is the side effects of the toxins, of the bad nutrition, of the poor lifestyle, of parasites, and everything else. So talking about this, another symptom when you're pre-diabetic is high cholesterol and high triglycerides. So both of them, they have links to heart. So one of the symptoms that's more prevalent in diabetes is heart problems. So many people experience these kind of issues. And if you have diabetes, this is something that you got to take care of yourself before it happens, because it's most likely that you're going to have them. What you can do about preventing? Number one, lose weight, especially belly fat. Now, how you lose belly fat? Removing parasites and detoxification. A real detoxification, because there's a lot of detoxifications in the videos and stuff like that. That's none, because they don't going to remove the real toxins. So we're talking about toxins such as mercury, lead, aluminum, things that they've been there for years, chloride, fluoride, things that they come in everyday things like water, food, medical treatments, stuff like that. You have to do this kind of stuff in order for you to get a very good outcome with diabetes. With my patients, I notice that parasites is a big deal. Why parasites? Because diabetes and the digestive system is related. You don't have a good gut flora, and parasites are not good flora, they'll never get well, especially they never lose the belly. In the past years ago, one of the symptoms that there were clear signs of parasites, it was the belly. Most people now, they have big belly and they don't do removal of parasites. So if you are there, you wanted to improve your diabetes, removal of parasites, a real detoxification, change your diet, change your lifestyle, add some stuff like walking, meditation, Tai Chi, Qigong, whatever you please, but you do something where the body moves and relate something with the breathing. Now, another factor is super important for any disease is stress. You have to find a way that you can remove your stress levels, reduce it. Stress is good, but not in high quantities. And especially if you are always drinking coffee, it's like always you're under stress, under emergency mode, and you don't want to do that. One of the things that you can do today is remove coffee. You can replace it with something else, like for instance, right now I'm drinking water with cocoa, raw cocoa, and that's it. And drink it, and it will be similar to coffee, not the same, but it has the bitterness, and it doesn't have caffeine, but it has a lot of antioxidants. It has a lot of nutrients, especially for females. They have iron, which a lot of patients they used to have lack of iron or anemia, or are prone to anemia. So anyways, you can always find a solution, finding a healthy alternative for the coffee. So one of the things that you can do today is start cutting off coffee little by little. Until next time, thank you very much. This is Georgina Zagaro Chavez, and stay tuned because we're going to give you a lot of tips about diabetes, about how to prevent diabetes, how to improve diabetes, and also what to do when you have diabetes. Until next time, thank you very much. Bye.